How can physicians motivate patients to improve their health? Find out in Medical Economics Pulse.
My questions have changed dramatically from the old way of having a patient interview and the new way of doing that. So the old way is what we were all trained to do, to ask very specific, how long have you had high blood pressure? How well is it controlled? Are you taking your medicines? Very important questions, critically important questions. We have to have that. I never asked, why does your health matter to you? How would you like your future health to be? Are you satisfied with the direction your health is going now?
How can physicians motivate patients to improve their health? It's the ultimate challenge for the modern doctor, who increasingly sees patients with complex chronic conditions that require a solid treatment plan and commitment from the patient to make lifestyle changes. But it's extremely challenging for busy doctors to find time during a 10-minute appointment to really connect with a patient in a way that makes a lasting impact. Many physicians champion a method of communication known as motivational interviewing, which is a specific way to engage with patients in a positive manner that seeks to build a relationship where both doctor and patient are working together to achieve one goal: improved health for that patient. How can physicians use motivational interviewing to encourage patients to make lasting changes to improve their health? To answer this question, we sat down today with Dr. David B. Wright, who specializes in treatment of chronic conditions and uses motivational interviewing every day in his practice. So I want to talk about chronic conditions and motivating patients to treat their chronic conditions and prevent their chronic conditions. So in general, what do you find as sort of like the main barriers to a healthy lifestyle today?
Oh, well, that's a great question, Chris. The barriers to a healthy lifestyle really start from birth. The environment that you grew up in. If your parents didn't model healthy behaviors, you're not going to learn healthy behaviors. And we know from the American Heart Association that only 1% of people follow healthy heart lifestyle. So we know it's a problem. Well, that means you had about a 1% chance of growing up in a home that practiced healthy lifestyle. And the thing about the brain and behavior is our brains are designed to really make most things automatic. And that includes, what am I going to have for breakfast? What am I going to have for lunch? How active am I going to be today? What toxic chemicals am I going to put into my body? How much sleep am I going to get? How much balance is there going to be in my life? All of those things, we get trained and educated, so to speak, from our family of origin. And you may be blessed with some good habits and some bad habits, or maybe they're all bad habits. But that's the biggest barrier. So we've got ingrained behavior that's automatic. We do it without thinking. Then number two, we really think we're bulletproof. As people, until something happens, until the bullet hits us, we are bulletproof. So yeah, Dr. Wright, I know that I should worry about that. I know that that's not good for me. However, and they may not say this out loud, but in their brain they're saying, however, I feel fine. And, oh, by the way, you really don't understand that the reason I smoke is because I'm under so much stress and I don't know what to do about that. Or the reason I binge eat is because I'm stressed. And that, I'm not saying stress is the source of all of these behaviors, but certainly is one of the reasons that they get triggered.
Can you talk a little bit more about motivational interviewing? What does that term mean, and how exactly do you use that in a medical practice?
So motivational interviewing, that's been around for 30 years, but I wasn't trained in it. And for the most part, most providers aren't trained in it currently, but it's been around and well validated. Motivational interviewing is a way of uncovering, why does a patient care about their health? Why does it matter to them to take better care of themselves? And what are they willing to do and not do in order to avoid some of the bad outcomes? So it's really an investigation of motivation. The standard medical interview is to find out medical facts that help me understand what's wrong with you. And we need that. So there's a medical discovery set of questions that are very much fact-oriented. Tell me about your blood pressure. Tell me about your blood sugar. Tell me about all sorts of things. We have to do that. But until you ask somebody those motivational questions, you don't really understand the barriers that they have, that they are facing to the new behavior. And so it's really a help me to understand you sort of question. I've shared with many people that I had a nurse that told me, Dr. Wright, you ask everybody what's the matter with them, but you're frustrated that they're not changing their behaviors, and what you really need to do is ask what matters to you. And that's really the essence of motivational interviewing. And so when we think about behavior change, we know from the trans-theoretical model of behavior change that people go from a pre-contemplative phase, where they haven't even thought about behavior change, through various stages that finally is executing on a behavior change and then maintaining that. So that's our goal, right, is to get to that point. Well, what that model left out, and I used that model, but didn't have very good success. And then I read about motivational interviewing, and this was what struck me, is that motivational interviewing doubles the likelihood of behavior change. And the magic is asking questions differently.
So how do you reframe a question? Maybe something that you would have asked, before trying to do this motivational sort of technique. So like, how is the questions phrased differently? What types of questions do you ask that maybe you didn't ask before? Can you kind of just talk a little bit about sort of some of those specifics?
Yeah, my questions have changed dramatically from the old way of having a patient interview and the new way of doing that. So the old way is what we were all trained to do, to ask very specific, how long have you had high blood pressure? How well is it controlled? Are you taking your medicines? Very important questions, critically important questions. We have to have that. I never asked, why does your health matter to you? How would you like your future health to be? Are you satisfied with the direction your health is going now? Those are the questions I start to ask now, is to understand, why does your health matter to you? And that's based in a model called the disconnected values model. And what that model says is that patients' core values about their health are usually that they want health. I mean, that is absolutely a core value. But their behaviors have become disconnected from those values, and they don't realize it. And so motivational interviewing is a way, once you find out, hey, I really do value these. Dr. Wright, I really would like to be at my granddaughter's wedding, and that's 20 years from now. I really would like to be spending a long retirement with my wife. Whatever those motivations are, they really want that. And once they've said it out loud, then you can start to say, well, tell me what you understand about how your blood pressure control might change your future. And just find out what they know, because they don't know as much as we think they do. Because they're bulletproof. And I'm bulletproof until the bullet hits me. And so you're connecting the fact that their current behaviors really don't support the things that they said they just valued. And then you can ask a question, would you like it to be different? How important is it to you to really get off of a blood pressure medicine, for an example? How important is it to you not to have a stroke? And we think we know the answer to those questions, but until the patient says it out loud, they don't know the answer to that question.
So one thing is, obviously these are, sensitive discussions. People are talking about their health. And I'm just wondering, how do you sort of build a trusting environment so patients feel comfortable talking about these topics?
Establishing a trusting relationship is critical. And I think most doctors do that pretty well. In fact, I think we all are able to do that well. We're there for the right reasons, and we do care about the patient. But when you get to some sensitive issues, that might be along the lines of, why are you still drinking? Why are you still smoking? That's what we want to ask, but that doesn't really help the conversation. So we know we're not going to ask those kind of questions, but we don't know how to ask questions that show, I'm interested in what you're interested in. We think that the patient's in our exam room because they want to stay healthy. Well, for men, it's often their wife that got them in the room, and it's the wife that wants them to stay healthy, and we all have patients like that we know they're not in the room for their health. They're just, to please somebody else. But even beyond that, again, patients don't fully understand what's at stake, and we do fully understand what's at stake. So showing that we're interested in what's important to you, what matters to you, what are you interested in doing differently, if anything, suddenly communicates clearly, gosh, he really cares about me. He's not just treating my blood pressure number. Yeah, I came for that. But this doctor really is treating me like a family member, as a friend, as somebody in his inner circle. I've never, a lot of people haven't experienced that in their visit. So for behavior change, that's critical because we trust our friends, right? And so you have to build that, and it's by the questions that you ask.
Obviously not, like all people, not all physicians are extroverted. Some are a little more shy or introverted. So how do you, and maybe there's some hesitancy in terms of like really sort of like opening up and engaging with a patient. So for those folks, how do you what are some tips for, because those conversations might be stressful. So what are some tips for to how to engage with patients in this sort of open way, if maybe that doesn't come naturally to you?
Oh, that's such a great question, Chris, because this doesn't come naturally to everybody. And I don't know if it's necessarily an introvert-extrovert paradigm, but there is something that's there. I'm an introvert, and it's been easier for me to learn this than maybe I thought it would. But I think here's the key. Physicians like to be confident and competent in what they're doing. Well, guess what? All of our training is on the medical side of things, diagnosing diseases, making those clinical decisions, making treatment decisions, making life-saving decisions. We're well trained in that. We're very confident and competent in that. What we haven't been trained in is what we don't feel confident in. And if I haven't been trained in motivational interviewing, for an example, or any program that helps with behavior change, then I'm not going to be confident. I'm going to be hesitant. I'm going to feel like I've either asked the wrong question or I shouldn't be asking this question. So the key to that is getting more education for yourself, understanding why should I even ask different questions? What's my motivation? Now, maybe my motivation is simply to get in and out of the room. I mean, I get that. I've been there. And there are days where you do have to just get in and out of the room because there's a true emergency that you really have to deal with. But if you're really trying to help people in chronic disease and behavior change, then you need to become skilled at asking different questions. So getting more education and then practicing. Patients really don't know that you don't know that. And so start with some simple questions. Hey, tell me who in your life you'd like to spend more time with when you retire, and what would you like to be doing? I mean, that's a real low, challenging question, but it shows some interest, and it can start you on that pathway towards those motivational questions.
So one of the, I can hear physicians, talking to me in response to this saying, how can I actually have time to have these conversations? And, a lot of that depends on your practice model. So what are some tips or advice you can give to help physicians sort of start chipping away at the time that they have so that they can actually spend some time with patients and ask some of these questions?
Chris, you're exactly right. The time element in the exam room is a pressure cooker. And it is challenging to say, wait, you want me to ask one more question or two more questions? that might give me an answer that makes me spend more time in the room. I get that. Let me challenge your viewers to this thought, that maybe some of the busy exam room visits that you're having are because behavior changes that they could have been doing a couple of years ago that they didn't do have allowed their disease to get to the point where they are in your office more often. We have great medicines. It's not that we don't have prescriptions that can treat these conditions, but lifestyle choices are still foundational when it comes to health, and especially for chronic diseases. So guess what? Your exam rooms might not be quite as full if you have patients that are engaged in healthier behaviors. So short-term pain is, I might spend more time in the exam room today. The long-term gain, and I can say this from personal experience, is patients are healthier. They are embracing their behavior change, and the visits aren't near as complicated as they used to be. And that's over 40 years, I can say that. So certainly think about that yes, there's a short-term pain, but is the long-term gain worth it? Is it of value to you? If the answer is yes, then again, you don't have to have long-winded discussions. I've thrown out lots of different questions, but a patient visit doesn't have to be all of those things. Here's an example. Mrs. Smith, I know you're here today to check on your cholesterol, and we will talk about that, but do you know why I'm concerned about cholesterol in you? And just find out where they're at. And if they have a great answer, say, that's exactly right. If they don't have a great answer, well, it's really because it can cause heart attacks and strokes. Mrs. Smith, would you like to know, besides taking a medicine, some things that can help you control that? And wait for the answer. I just motivationally interviewed somebody with 2 questions that were interspersed with the regular visit. And if she says, no, I don't really want to learn any of that today, I'm out of the room just like I always would be. If she does say, well, yeah, I'd like to know more. Well, for cholesterol, for an example, I might say, well, there are certain foods that are better for you. Moving more might be better for you. Which of those would you like to learn more about? And then have some resources that you can point your patient to. Mrs. Smith, I've got a pamphlet for that. I've got a video on my website. I've got a solution for you. A lot of the viewers might say, but I already do that. I already hand out pamphlets. I already tell them where the videos are. Here's what I would say: until you've discovered that they really care about learning that information, which is their motivation, you're just using words. You're actually wasting time to tell them to do things that they're not even ready to do. So number one, you're going to save time because you're not wasting time on that conversation. But number two, you're actually going to open up time for the really powerful conversation that can change their health care trajectory.
How important is it to personalize care plans? And I know we talk about personalizing care plans, and it's it's an easy phrase that everyone talks about. But what does that actually mean to personalize a care plan?
So if Mrs. Smith, if I've asked her if she's willing to consider either a nutritional plan or a movement plan to help her get off of her cholesterol medicine or reduce the dose of it, whichever one she picks, then I can say, well, great, if you want to do more exercise, what are the sorts of things that you enjoy doing? What would you like to do that gets you moving more? And let the patient develop the plan. I used to say, well, Mary, you need to walk for 30 minutes a day, or you need to eat this food and not that food, and be very prescriptive about it. Well, instead, invite the patient to say what kind of a choice is even in their realm of possibility. And wherever they start is a start. And so I try to personalize it that way. Where are you willing and able to start? And I'll let them outline that. And I may ask a few other questions. Well, do you think you could do anything else? That's a great question. You know, they've said what they think they can do. Is there anything else that you can do? And then the last question, whenever they've stated, here's what I'm willing and able to do, Mrs. Smith, on a scale of 1 to 10, how confident are you that after you leave my office today, that you're actually going to be successful in this wonderful plan that you just said is right for you? And this is scientifically validated in the motivational interviewing science, that asking that question is critical. Because if a patient says that they're below 7, they are not going to be successful. There is a barrier that you don't know about that's going to prevent them from being successful. If they say 7, 8, or 9, you can confidently say, Mrs. Smith, that's awesome. I know that you're going to be successful. I can't wait to see the results the next time you're here. If they say a 10, they've actually undershot what they can do. They're sandbagging on you. Because if they're that confident, then that's when I always ask the what else could you do question, because they've picked the easy, low-hanging fruit. Now, what do you do for the 1 through 6s? Well, they've got a barrier. And if you don't know what that barrier is and let them solve it during that visit, they're not going to be successful. So a real simple question is, Mrs. Smith, what would it take? You told me you have a confidence level of 5 to do what you just said. What would it take to move that up to 7? What would have to be different about your plan? Oh my gosh, all of a sudden you hear, well, I've got this, I've got to pick up the kids on this day when I said I was going to exercise, and I've got to do church activities on this night, and my calendar's just so full. Wow, Ms. Smith, thanks for sharing that. Knowing all of those things, where could you start right now? Let her redesign the plan and then ask the confidence question again. It is magic because they've designed the plan, they've personalized it. You don't have to have that burden on you. And number 2, they've said, I'm confident I can do this.
So one of the things that we often hear about is sort of frustration with patients, that they're not, holding up their end of the bargain, that, like you were saying, that they leave the office and then when they come back in 6 months or whenever, that it's just they haven't made progress. Well, the patient didn't listen to what I was doing. How would you sort of talk to other physicians about sort of that thought process and sort of, because obviously they're responsible for their health, but physicians, I'm not sure if that's the relationship they want to have with their patients. Can you just sort of talk about sort of that attitude and sort of maybe how physicians can adjust or recalibrate their expectations?
Noncompliance is a powder keg in the exam room. It's the elephant in the room that's hard to talk about. And it does cause frustration. And physicians are human beings too. When we see a threat to our way of life, which is helping people get healthy, that's why we're there. And when somebody's not doing what they need to do to get healthy, that's a threat to who I am and what I'm trying to do. So I'm going to have a fight or flight response. And the flight response might be, how soon can I get out of this room? And that's real. That's happened to all of us. The fight response might be to go into lecture mode. I've told you that this is bad for you. When are you going to listen? It's the lecture. And maybe it's not as stern as I just said, but it's still a lecture. That's normal. So what we have to do as physicians is do what we would do with our loved ones. I might be mad at my wife about something, but I'm going to take that deep breath. Okay, help me to understand why you're unable to take your medicines on a regular basis. Just ask questions to understand what their barrier is. The problem is we don't know what their barriers are. We know what they should be doing, but we don't know why they can't do it. So find out, Chris, why are you having trouble taking your medicines? Why are you not able to get the refills? And you can do that for any of the behaviors that are noncompliance. So seek to understand their noncompliance instead of to have the fight or flight. The fight or flight you're going to feel. And it may take a long time of practicing how to extinguish that to get better and better at it. But until you do that, you're not going to have a productive conversation. And that leads to burnout too, doesn't it? Because satisfaction with what we do in our work is very much tied to the outcomes in our patients. And a bad outcome is going to make me feel miserable.